Today we are going to be talking about something that is known as gastric emptying. What is gastric emptying? It is the movement of your food particles together with the drug from your stomach to your intestines. So we have to be discussing about the factors that affect the movement of the food from your stomach to your intestines. Why are we discussing about this? Because most of the drugs are absorbed in your small intestines, and as a result we have to discuss about what affects the movement of your food, the time taken for your drugs to leave your stomach to reach the intestines. So here are some of the factors that we'll be discussing today. We'll discuss about so many factors, maybe 4 or 5 factors that affect the rate or the time taken for your drugs to leave the stomach and enters the small intestine and also get absorbed and become bioavailable. So I also have spoken this big word, bioavailable. So what is bioavailability? Bioavailability is the rate and extent of the amount of the drug that is available in your circulatory system, that is the blood. So the amount of drug that is inside your drug, that is inside your blood, the circulatory system, this is called the bioavailability of the drug. So here are some of the factors that affect. So the first one is the volume of your food. The volume of your food affects the gastric emptying of your stomach. So when you eat the food, like less volume of food, like a small volume of food, the gastric emptying time is very less, is small. So the time taken for your food to leave your stomach and enters the intestines is less as compared to when you eat large amounts of food. So when you're taking drugs, it is advisable for you to eat small volumes of food, because it will actually reduces the time taken for your drug to leave the stomach and enters the intestines. And when that happens, your drug will be absorbed much more faster, and it will be bioavailable. It will be bioavailable for that effect that you want much more faster. Now we move on to the second one, that is known as the composition of the food. This is number 2, the composition of the food. So there are 3 that I will talk about today: food that is rich in carbohydrates, food that is rich in proteins, and the food that is rich in fats. When you are taking drugs, especially those ones that goes through your stomach, if you eat the food that contains large amount of carbohydrates, the time that is taken for that food to leave the stomach and enters the intestines is less. But if you eat the food that is large amount of fats, the food that is rich in fats, that food will take much more time to leave the stomach and enters your intestine, and as a result it affects your drug. Because if your food takes much more time in your stomach, it will also increase the time taken for that drug to be absorbed and become bioavailable for the effect that you want. So always try to eat the food that contains large amount of carbohydrates, followed by maybe the food that contains a large amount of proteins, and try to avoid food that contains large amount of fats, because the food that has large amount of fats is the one that takes much more time in your stomach and increase the time taken for that drug to reach your intestines. So first, the food that contains carbohydrates takes lesser time, followed by the food that contains proteins. This one is the one that follows. Then the food that contains fats is the one that takes much more time. So start with the carbohydrates, then the food that contains protein, then the food that contains fats. So try to avoid the food that contains fats if you're taking drugs, because it will increase the time taken for your drug to produce the effect that you want. Now move on to what is known as body posture. Body posture also affects the gastric emptying of your food or your drugs there from your stomach. So you realize that when you are standing, the gastric emptying time is less as compared to when you're sitting. And also when you're lying down, when you're sleeping, lying down on the right side, the gastric emptying time is less as compared to when you're lying left side. So always try to stand, try to do those things, try to stand, and also when you're lying down, try to be on your right side. This actually reduces the gastric emptying time, and also make sure that your drugs reaches your intestines much more faster. Now we move on to the other thing that is known as the emotional state. Your emotional state also affects the gastric emptying time of your drugs or food there. So you realize that someone who is stressed and has anxiety will affect the gastric emptying time in such a way that the food leaves the stomach much more faster as compared to someone who has depression. So always avoid depression, because depression actually increases the time that is taken by your food to leave the stomach and enters the intestine. And as a result, it will increase the time taken for your drug to get absorbed, and also for your drug to be bioavailable for the effect that you want. So you want that drug to produce the effect that you want at the right time and when you want it to produce that. So always try to avoid depression, because it will affect your gastric empty time, affect the bioavailability, and affect the absorption, and also affect the time taken for you to feel or see the effect that you want. Lastly, we'll talk about the gastrointestinal pH. So you realize that the less acidic your stomach is, the faster your food will leave the stomach. But when the pH is high, the food will take much more time. So always try to avoid all those things that will increase the pH of your stomach. And as a result, this will help you to make sure that you see the effect that you want at the right time that you want. So these are some of the factors that affect the gastric emptying. They affect the time taken for your food to leave the stomach and enters your intestines.